Hello everyone. In the last class, we learned about the topics behavioral disorders or conduct disorders. In Unit 5, disorders of infancy, childhood, and adolescence. Today topic is oppositional deficient disorders or ODD. Let us we learn about this. Definition: Oppositional deficient disorders. What means oppositional deficient disorders? Is a behavioral disorder characterized by a persistent pattern of angry or irritable moods, argumentative or defiant behavior, and vindictiveness towards the authority figures that last for at least 6 months and causes impairment in social, academic, or family functioning. What are the definitions of ODD? According to DSM-5, ODD is a pattern of angry, irritable mood, argumentative, defiant behavior, or vindictiveness lasting at least 6 months during interactions with at least one person who is not sibling. Introduction: Oppositional deficient disorder is commonly seen in children and adolescents. Children with ODD frequently argue with parents, teachers, and other authority figures. They refuse to follow rules, become easily annoyed, and deliberately upset others. Unlike conduct disorders, children with ODD do not usually show severe aggressiveness, aggression, theft, destruction, or property destruction of property, or serious violation of others' rights. Epidemiology: More common in boys during childhood, usually begins in preschool or early school age, often occurs with ADHD, anxiety disorders, or mood disorders. Etiology: What are the etiology? The exact cause is unknown, but it is believed to result from multiple interacting factors. First, biological factors like genetic predisposition, neurotransmitter imbalance, difficult temperament, brain function abnormalities. Then, second, psychological factors: poor emotional regulation, low frustration tolerance, poor impulse control, low self esteem, difficulty coping with stress. Family factors: inconsistent discipline, harassed parenting, lack of supervision, family conflict, child abuse or neglect, parental mental illness, parental substance abuse. Then, fourth, social factors: peer rejection, school problems, bullying, poverty, exposure to violence. 5. Environmental factors like stressful home environment, and poor parental child relationship, negative peer influence. Then, what are the risk factors? Family history of behavioral disorders, ADHD, conduct disorders in family members, poor parenting practice, childhood trauma, domestic violence. What are the clinical features? Angry, irritable mood, fast, frequent low temper, easily annoyed, angry and resentful, irritable mood, B ହେଲା ଯେ କି argumentative, frequent argues with adults, refuse to obey rules, defiles authority figures, deliberately annoys others. Then vindictiveness, spiteful behavior, seeks revenge, holds grudges. What are the diagnosis? Diagnosis is based on the detailed history, observation of behavior, clinical interview, DSM-5 criteria, reports from patients and teachers. What are the differential diagnoses? Conduct disorders, ADHD, autism spectrum disorder, mood disorders, anxiety disorders, and diagnosis. What are the management? First, behavioral therapy, positive reinforcement, behavior modification, reward system, social skill training. Parent management training. Second, parents are taught to use consistent discipline, set clear rules, reward positive behavior, avoid harass punishment, improve communication. What are the third points? Cognitive behavioral therapy helps the child control anger, solve problems, improve emotional regulation, develop healthy coping skills. Fourth, family therapy. What are the family therapy? Improve family relationship, reduce conflict, enhance communication. Then five school-based interventions. What are the school-based intervention? Teacher support, classroom behavior plans, regular communication with parents, academic assistance. Sixth, medication. There is no specific medication for ODD. However, medication may be prescribed if the child also has ADHD, anxiety disorders, depression, severe aggression. What are the nursing management? First, assessment. Assess behavioral problems, anger level, family relationships, school performance, peer relationship, emotional status, presence of other mental disorders. Then establish a therapeutic relationship like build trust, be calm and respectful, maintain consistency, avoid arguing with the child, behavioral management like reinforcements positive behavior, set clear and consistent limits, praise appropriate behavior, ignore minor attention seeking behavior when appropriate. Anger management, like teach deep breathing, relaxation techniques, problem solving, emotional regulation, assertive communication. Family education, teach parents nature of ODD, positive parenting techniques, importance of consistent discipline, avoid physical punishment, encourage regular follow-up. School collaboration, communicate with teachers, monitor classroom behavior, encourage positive reinforcement, support academic progress. Social skill training, like encourage the child to respect others, cooperate with peers, develop communication skill. What are the rehabilitation? Encourage participation in sports and hobbies, improve self-esteem, promote healthy relationship, support long-term behavioral improvement. What are the complications? If untreated, ODD may lead to conduct disorder, poor academic performance, family conflict, depression, anxiety, substance misuse, social relationship problems. What are the prevention? Positive parenting, early behavioral intervention, school counseling, family support, stress management, early treatment of ADHD or other associated disorders. Role of the nurse. The psychiatric nurse should assess behavioral and emotional problems, build a therapeutic relationship, promote positive behavior, teach anger management skill, educate parents and teacher, coordinate multidisciplinary care, monitor progress and encourage follow-up. Difference between ODD and conduct disorders. Mild to moderate behavior disorders, more severe behavioral disorders. ODD ହେଲା ଯେ mild to moderate, ଆଉ more severe behavioral disorders in CD. Argues with authority figures in ODD, in conduct disorders, violate the rights of others. In ODD, defiant and disobedient, CD, aggressiveness, destructive and dishonest. An ODD does not usually destroy property. In CD, may destroy property. Does not usually steal in ODD, may steal or engage in robbery in CD. Thanks to all for listening my topics. Jai Jagannath.